Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, have you been to see your healthcare provider lately? When you go, you'll soon find out electronic record keeping. What's that all about? And then how are our colleges and universities dealing with this recession? All of that after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. As always, we appreciate your viewership. Well, what a program we have today. Electronic record keeping. How important is it? Why should you care? Something called e-prescribing. I didn't know much about it. You're going to find out about it. Joining me to talk about those subjects right across here is Augusta Kairys. Did I get that right?
Yes, you did.
I'm getting better at that. She's a Vice President of Provider Relations at Highmark. And Tom McGann, he is a Senior Vice President with, Dr. McGann at WellSpan. And Michael Madden, another physician. And you're with?
WellSpan Health.
WellSpan Health, over in
York, PA.
You can see you got that commercial in. All right, folks, look, first of all, thanks for coming on. The stimulus package brought $16 to $18 billion into the state. Billion, I got it. $4 million of it into health care. We're only going to talk about the piece today that deals with electronic record keeping. Why should anybody care about this?
Well, for a long time, there's been concerns about the quality of care in the United States healthcare system. And one strategy to improve that care, particularly in physician offices, is moving it from the old traditional paper records, which sometimes could be this thick, to a much more efficient and organized way to provide storage of those records and organization to those records in an electronic system like every other industry.
Yeah. You know, Doctor, one of the people complain, I have the worst handwriting in the world, but people used to say that there could be actual mistakes made because of of people's handwriting. You're writing quickly, and you can't interpret or read. Is that a problem, or is that just something we hear about?
Oh, it's absolutely a problem. We have multiple examples over the years. We use them in conferences and put up prescriptions and ask people to try to interpret it. And the pharmacists, if you really want to know, ask them how hard it is to interpret. And a lot of our drugs are very similar in names, and if you interject the handwriting, it's just a potential for mistakes. And
so electronic your argument would be then that is one of the other benefits from keeping electronic records as opposed to scribbling. Somewhere along the line, the scribbling has to, or is this going to be like they're going to dictate, and then from the dictation it would go to into a computer system somehow? Go ahead.
It's more of a point-and-click type of system on a handheld device generally.
We know about those handheld devices.
Right, exactly.
We're using them all the time.
Sure, and medication errors are accountable for millions and millions of dollars of the healthcare spend. So improving that is key to bringing down the cost of healthcare.
Now it also has one of the concerns I think that some folks might have would be the doctor-patient relationship. Is that going to materially change that?
Well, it does, because you have to remember a lot of physicians are not comfortable on computers. They don't type well, and you put the computer in the exam room, and the temptation in the beginning is to be all engrossed in that screen instead of paying attention to the patient. So we actually have to work hard on that to integrate that into the relationship.
Yeah, good point. Walk through. I'm a patient. I come in to see you, right? How would this all work? We're having a conversation.
Right.
Go ahead, and
it doesn't start with me. It starts the minute you schedule your appointment, that the office is much more able to identify what you really need for that visit. Because you may not know that you need a lot of preventive services, but the office can be prompted to provide those to you even before you see the doctor with an electronic system. With a paper system, much more difficult to do that. But then once you come in to see the physician, and after a better team approach to care for you, then the physician has a more prepared patient and is more knowledgeable about the things you need.
So it saves time, and hopefully it saves. Could this actually is this a cost reduction factor as well, do you think?
Well, I think a lot of physician practices will say that it really hasn't been a cost reduction factor for them.
Yeah.
It ultimately has the capability of reducing our overall healthcare costs because care is delivered much more efficiently, and people do get the preventive exams that they need that they might not have gotten, as Dr. Madden said, if they were relying on a paper record to prompt that. So, you know, from that perspective, it does. But the cost of adopting the health information technology is really a barrier for a lot of physician offices.
And that's part of the reason why there needs to be some outside help. I'm sure a lot of consumers wonder, why would a doctor's office need somebody to help them make this move to electronic records?
Because they're doctors. They're not
because they don't,
technocrats,
because
right?
they may not get all the benefits of that cost.
Oh, I see what you mean.
You know, where a bank may or some other business may. But the benefit of the expense often goes to the patient or to their employer by lower health care costs, but not to the doctor's office.
Yeah, we're going to go to break. But I'll tell you what, when I go in, this doctor-patient relationship is very important to me, and I know to a lot of folks that I know. I mean, this is very important. And maintaining that, nothing I think can interfere with that. I mean, we all would agree there. That has to be maintained. That's the vital component. This, you're arguing, could actually make that relationship better.
Oh, there's no question in my mind it can.
All right, we'll be back. We're going to talk about something called e-prescribing. I don't know anything about it. We're going to find out. That's why they're on the program. Back in a moment. Good.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Well, we're talking about electronic health records, a big change stimulated by the stimulus. I think that's a good way to put it, in part because some of the funding comes from the federal government stimulus package. Dr. McGann, I called you McGann. Dr. McGann, I called you McGrann. You see, I finally got that right. It took me a while. Doctor, why does this take so long?
Well, it's hard. It requires a lot of money. Training, we underestimate how much training it requires of both staff and physicians. And you have to rework all the workflows in the office. So it took us about 6 months of prep time for each practice. We have 60 practices. We have about 80% of them up now, but it's taken 2 years. So it's a slow process.
Yeah. Now, if it's a slow process, that means it's also a costly process, right?
Well, yes. There is definitely a cost to adopting technology, both the financial cost of purchasing a system, but also physicians tell us that they have loss of productivity as they get used to using new technology in their offices. We've heard everywhere from 6 months to 6 weeks in terms of downtime, if you will, while they're converting their records and then learning how to deal with their patients in an electronic environment. So Highmark understands that the value proposition isn't always where it needs to be for physicians, and we made a grant available to physicians in the 49 counties that we cover for a physician to get up to $7,000 for the adoption of health information technology. Now that doesn't cover the whole cost.
No, that's not part of the stimulus. That's a grant from your own.
That's correct. Yes.
Yeah. Dr. Madden, segue here. Physicians are going to avail themselves of this, hopefully. But what is e-prescribing?
Electronic prescribing is doing away with the old paper prescription pad and sending the information from the physician's office to the pharmacy electronically. So as Dr. McGann talked about earlier, eliminating the problem of handwriting, so a lot fewer errors, and a great convenience for patients. Then no more having to take the script, wait around for an hour, go back and get it, that sort of thing. Can be there waiting for them when they get there. And then the same thing can happen with refills, that the pharmacy can send the information back to the physician's office electronically. As well as the doctor can view all the prescriptions that patient is on.
It certainly makes a lot of
safety issue.
Yeah, it really makes a lot of sense. Dr. McGann, Is this how are doctors taking to this? I mean, you talked a moment ago about how long it was taking,
right.
and we hear about how expensive it is. Of course, in the middle of a recession, talking about this kind of change. How are your folks?
It's hard to generalize because all doctors have different views on these
really?
things, believe it or not.
Yeah.
And we have the early adopters and the middle adopters and the late adopters. And we have all of those. We have lost one physician who left because they did not want to make the transition.
Wow.
One of the best ways to answer that, I think, is that we measure that and know that about 35% of our primary care physicians have made the switch.
Mm-hmm.
Fewer numbers of specialists because their needs for owning information often aren't as great as a primary care doctors are. Yeah. In terms of electronic prescribing, a higher percentage, about 45% now, are sending scripts, primary care, to the pharmacies electronically.
I mean, I think you make a good point. I mean, I go in and I look at my primary care physician, my folder, it's like a foot thick, right?
Yeah.
But I go, I had a knee replacement. I'm sure it was just a little. That's your point, right?
That's exactly right. The orthopod's chart's that thick, the primary care guy's is that thick. Because he generally has everybody else's in his chart.
Yeah, what do you think in the long, I mean, is this transition, how long is this going to take?
Well, we've been pursuing the adoption of health information technology at Highmark by physicians for about 4 years now, and we really haven't made as significant a progress as we'd like to. I mean, if you look at the entire state of Pennsylvania, less than 20% of the physicians are using health information technology in their offices. So I think 20%. It's going to be longer, but there are a lot of incentives out there from the private side as well as the government, and actually, by the year 2011, every physician should be using electronic prescribing for their Medicare patients, or they face a negative incentive from Medicare.
Yeah, and who knows what's going to happen with Medicare. I mean, one of the plans insists that Max Baucus is working on the finance chair and who's overseeing the Obama health care plan is payment, Medicare, quality care consideration. So that's your, that's your point. And
exactly.
That's probably going to.
And these incentives are tied to quality measurement and quality reporting.
All right.
You don't get them without that.
Yeah, great update, Dr. McGann. You see, it only took me 15 minutes to get that. Look, this was a great update. Come back. You'll keep us informed about how this is working. All right, how's higher education doing with a recession? Well, we're going to tell you about that following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. We're going to shift gears from healthcare to education, higher education in particular. Joining me to chat about the problems that higher education is having during this recession, that might be a good way to put it, is Karen Ball. She's a Vice Chancellor for External Relations with the State System of Higher Education, and Jim Moran. He's the Vice Chancellor for Academic and Student Affairs in the state system. Long title, Jim. Let me start. Hey, professors have long titles too. Let me start with, look, this is a tough time, I think, for colleges and universities all over the country. State system, huge provider, largest, I think, in the Commonwealth. Do I got that right? Number of students.
Yeah.
Give me talk a little bit so that our viewers, and particularly the parents out there, can get a sense about what's going on in this environment.
Well, I think it's interesting because certainly one of the things for us is because of where we're placed in terms of affordability, in terms of the economic times, we're finding our institutions, I think, have had increased applications. That whole issue of trying to address affordability is one of our key issues because of, I guess we view ourselves as the public universities for the state.
Yeah.
And access, and at the same time, we've been working very hard on the issues of quality and accreditation. But that's part of our mission. I mean, that's where we see ourselves as critical. So,
but typically you would draw, Karen, as you know, you tend to draw students who are less well off, and for still a lot of first generation kids my age, I can call them kids, you know, students, and I mean, it still must be tough for a lot of your students, right?
Right, it is.
Now, one of the things I know that you're working on, that you work on specifically, is the appropriation process and the money. How does that all look? Because you live heavily on the state appropriation.
I think we're realistic this year that it's going to be a tight year for everybody. We are very lucky, though, because when the federal legislation passed, it specifically took care of the public universities in every state.
Right.
So we're probably doing a little better than some people because of that language.
The stimulus money?
The stimulus money is helping us a lot, and it's helping us stay fairly level, we hope.
Now, go ahead.
I was going to say one of the perspectives of that, even though one can say that these are economic downturns, I think we see, and partly because of some advantage of the stimulus money, we need to reach out to some of the underserved areas in the state.
Yeah.
We know that just access to higher education, not just a matter of affordability, but it's also a matter of location.
Now, does that get done by expanding? Is this going to be done electronically, by more, internet-based courses, or are you going to put up actual facilities or borrow, rent, whatever you have to do to get out there?
I think that's part of it. I think the other part of it is we've really expanded into non-traditional areas, especially up in the northern tier where there are no community colleges. Yep. We had 80,000 enrollments in our system last year of non-credit job training, customized job training courses. And
now hold on a minute. I want to stop because I don't think a lot of people. Let's put a exclamation point on that. I mean, I think most people think, well, go to maybe more for community colleges for that, but repeat that again.
Well, we had 80,000 enrollments. So some people take more than one course, but we had 80,000 enrollments in non-credit job training classes. And it was taught by our faculty. It wasn't necessarily on our campuses. It might be at non-traditional places. And one of the things that we're really focusing on in the budget is job training money because a lot of our campuses are moving that way.
Yep, and I guess in a state like ours where we continually have these transitions, we had it in the 70s and 80s out of the old industrial system into technology and social and the service industries. So now in a recession, it's probably, go ahead, even more important, right?
That's exactly right. I think that's why instead of kind of coming back into ourselves, we know that we need to be reaching out to help serve the Commonwealth in terms of, there's not in that, what we label that northern tier, access to community colleges. The urban areas, also people who are place-bound,
so we've got
need to be
urban areas and rural areas, suburbs maybe a little better off, both in terms of finances and in terms of the... All right, we're going to run to a break. Video poker, I want to ask you about that. And I know you can grin, but Governor Rendell has been all over the state. He's been on here. He's talked about get into video poker, higher ed, and how the hell that's going to work. We'll do that in a moment. Back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. I'm talking with Karen Bull and James Moran from the state system of higher ed, talking about higher education, what's going on in public higher education especially. Karen, we've got this video poker deal that the governor wants to pass. I don't know, my own view is it's going to have a tough time, I guess, in the state Senate. But he is tying it to aid for public education. What do you think about that? What do you both? I'll let you and then Jim, you can take a crack at it.
In the big sense, we're thrilled that people are talking about tuition issues, and
Right.
they're talking about affordability.
Right.
So we've been very active putting that case together.
Okay.
Chancellor is going to be at a hearing tomorrow. We've had, well, we will have had 3 of our presidents at public hearings, you know, all over the state, which has been great for the system. We're the most affordable option for
Right.
people, and it's great to get that
So
message
the point
out.
is that, so your point is the focus of it.
Right.
Go ahead.
Yeah, I think obviously the framework of trying to have students graduate without debt is a really important type of issue, and I think that's one of the things as we look at the economic times is really critical. And I think that idea of trying to think about, in all of these proposals, trying to think about that 7th and 8th grader who may be saying college may be more of a reality rather than just a dream, is what it's all about. And I think those are really important kind of issues for us.
Yeah, I want to go back to Karen on the big budget picture in a moment, but you know, one of the things that I've talked about with other folks from the system, like Peter Garland, who's been on a lot, and others, is this business of seniors, smart kids. Why are they spending their senior year in high school? They could move on to college. Something that I know you all have a great interest in some of the colleges that are doing this. I want to talk with you all about that sometime in the future. Look, this is a pretty tough budget year. State has a $3 billion deficit. The Republicans have one budget, $1.5 billion less than what the governor. Tough time. I mean, you didn't schedule a vacation for any time after July 1, have you?
No, I did not. No, I'm not going over to October,
Okay.
which I hope doesn't mean that we'll keep going. It is a tough time, and we have to make some tough choices internally and externally. But again, we are lucky because of the federal stimulus package. We're not going to see the kind of cuts that some other agencies are going to see. So there's good news and bad news.
One of the things, of course, is over the last decade, our institutions have reduced their budgets by about $200 million, which is one of the reasons why, as we've looked at the past 5 years, we've been able to keep tuition reasonable, which gets back into that whole emphasis on access and affordability for ourselves. And that'll probably continue, that emphasis will continue.
Okay, we're out of time. I want to thank you. Great job. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.